this article summary, I chose obstetric MRI because my modality in my program is MRI. So as we all know, ultrasound is the imaging modality of choice during pregnancy, but more recently, MRI is being increasingly used in patients whom the diagnosis is unclear. The conditions that were referenced in my article and the ones that I chose to further investigate, I guess, were adnexal masses, ectopic pregnancy, and gestational trophoblastic disease. MRI can also be used for fetal anatomy and pathology, typically used for the evaluation of central nervous system disorders in the fetus, complex abnormalities that are not fully characterized by ultrasound, and the evaluations of patients during fetal surgery, or desiring fetal surgery. Prior to scanning, so as always, the maternal screening forms are just like any of the other screening forms used in MRI. Used to rule out used to verify that the patient does not have anything that is contraindicated to MRI. So cardiac pacemakers, defibrillators, aneurysm clips, things like that, pain simulators, and then as well as a fetal written informed consent regarding the safety of MRI in pregnancy. This is obtained because relatively little information has been is known about MRI and pregnancy, as well as the safety to the mom and to the fetus. So although deemed safe for scanning, it's only safe for scanning at 1.5 Tesla magnets. It is well known that in dividing cells, which is in the case of a developing embryo during the first trimester, they're susceptible to injury from a variety of physical agents. It's kind of why you can't do X-ray, CT, things like that with ionizing radiation in the fetus. Because of the limited data known about MRI regarding the fetus and the known information regarding cell division, it is recommended that MRI be avoided until the second and third trimester. It is also recommended that scans be performed without contrast. Gadolinium is going to be the MRI contrast of choice. It is safe in humans, or, like adults, but not many people want to just offer up their unborn child for testing, so there is there's less information known about how the fetus is going to handle the contrast. But it is known to cross the blood barrier, and so present in the blood and the kidneys, and then also be present in the amniotic fluid. So they avoid these because gadolinium deposition can be retained, and that's a big study right now with just people in general. Gadolinium has been shown to be retained in the organs like skin, brain, and other organs, which is now to be concerned. So I don't know if you have had a scan with gadolinium, but that's a new thing that's kind of coming out, so it's kind of unknown. So the first pathology that I kind of researched a little bit more was going to be the adnexal mass, and the adnexa itself is the area next to the uterus containing ligaments, vessels, fallopian tubes, and the ovaries. So the adnexal mass itself is a lump of tissue in the uterine adnexa. It can be benign or cancerous, and they can be categorized as simple or complex. So that's where MRI comes in. When it's found with ultrasound, they are categorized based off MRI because of the detail. Symptoms of adnexal masses include abdominal fullness and pressure, abdominal bleeding, pelvic pain, difficulty with bowel movements, increased frequency of urination, and abnormal bleeding. So this one kind of stood out to me because, if you go to the next slide, it's going to be pictures of MRIs of adnexal masses. This is going to be a coronal image, which, to orient yourself, the coronal image goes kind of like this way. So this is going to be like the femoral head. So this is going to be your hip, so this is your femur, and this is your pelvis. So right here, you can tell that that's just sitting right on the bladder, so that would make sense. And then this axial slice is going to be taken.
Teachers, I need the Veterans Day Decoration Committee to meet in the cafeteria at this time. The Veterans Decoration Committee to the cafeteria, please.
So that axial image, I would presume, probably came through about here, because you can see the lobes of that mass right there. So MRI imaging of these masses. So one of the most this mass is actually pretty common. So these masses are one of the most common reasons that you would receive an MRI while pregnant. So it's going to be, if you are known to have an adnexal mass, you're going to likely do an MRI if you are within your second or third trimester to assess the complexity of the mass. So ultrasound can give an accurate description of size and character, but if the patient is considering having surgery, they are going to do an MRI to verify the complexity, the margin, the origin, and the nature of the mass. So FastSpin echo images will be obtained in the axial, parental, and sagittal planes, similar to the ones I showed you in the previous slide. And if you're interested, these are the parameters. I won't go into all that just because no one will understand. So go ahead. Same thing with this one. It's going to be the time of flight images that typically watch the flow, so maybe the vascularity to that mass, and these are the parameters for that. Same thing with the axial T1 weighted images, in phase and out of phase images, and these are the parameters for those. So moving on, the second pathology discussed in my article was ectopic pregnancy. So ectopic pregnancy occurs when the fertilized egg attaches itself in a place other than inside the uterus. Almost all of ectopic pregnancies occur in the fallopian tube, and therefore sometimes called the tubal pregnancy. Fallopian tubes are obviously not designed to hold a growing embryo, so action will need to be taken to correct that. So, which I also found this really interesting. An ectopic pregnancy occurs in 1 in 50 pregnancies, which is pretty common. I feel like I've probably known 50 people to be pregnant in the past year, maybe. So that just seems pretty high to me. So symptoms of ectopic pregnancy. So sharp or stabbing pain that may come and go and vary in intensity. That pain can be in the pelvis, abdomen, or even, interesting again, up under the shoulder and neck due to blood pooling from a ruptured ectopic pregnancy. So I feel like a lot of people probably won't know that they had an ectopic pregnancy until maybe, it's probably usually pretty early on, and they probably would experience a miscarriage from that. Vaginal bleeding occurs often, along with gastrointestinal symptoms and weakness, dizziness, or fainting, probably from the bleeding. The likelihood of having a ectopic pregnancy is going to increase with age, increase if you have pelvic inflammatory disease, have had previous induced abortions, or conceive after having a tubal ligation or while an IUD is in place. So I included some pictures of that ectopic pregnancy again. So like I said, ultrasound is going to be the primary modality of choice for imaging the fetus. This abdominal ectopic pregnancy was recorded at 18 weeks gestational age. So this is going to be the head of the infant, the fetus, and then you can tell that it's located, this is the uterus. So you can tell that it's located outside of the uterus. And then I included an MRI image as well. This is going to be a sagittal image. So this is your back, your lower back, and your tail spine. This is going to be your placenta, and this is the uterine cavity, so the placenta should be in the uterus. This is your bladder organ here. So imaging of the ectopic pregnancy. So MRI can be utilized to determine the extent of the involvement before surgery. So sometimes these require surgery. This is going to reveal the degree of the uterine invasion. So sometimes it can be not completely in the uterus or completely in the fallopian tube. It just varies based on the person, because, like I stated earlier, it can be an ectopic pregnancy can occur in any part of your reproductive system as long as it's outside of the uterus. So the MRI is going to show you more detail. See how I included the same picture from the previous slide. This is going to show you the location and origin. So if you look at the ultrasound, yes, it's good for determining some things, but you can tell that it's outside of the uterus, but if you do an MRI, you can tell, you know, exactly where, this is gonna be a different person, but this is a uterus and this is where it's bulging out. And then, with MRI, you can do reformatting of the images, post-processing, and be able to tell the vasculature, how it's growing, so where the vasculature is coming from, where it's connected, so the vascular supplying the pregnancy itself. And this was actually done with gadolinium, which to me is uncommon because you don't typically do gadolinium. That's going to be the contrast for MRI. You don't typically do that with pregnant patients, but it is done when necessary. So another disease that was mentioned in my article is going to be gestational trophoblastic disease, and that is a group of rare tumors that involve abnormal growth of cells inside the woman's uterus. So the tumors start in the cells that would normally develop into the placenta during the pregnancy. So most gestational trophoblastic disease tumors are benign and they don't deeply invade the body tissues or spread to other organs. So typically they can be easily removed, but that's not always the case. Symptoms of this include abnormal bleeding, severe nausea or vomiting during pregnancy, high blood pressure at an early point on in the pregnancy, pain and pressure in the pelvis area, and abdominal swelling. Which, to me, some of these are kind of hard to maybe pick out because I feel like some of these you're going to experience during pregnancy. You're probably going to be nauseous. You're going to have pain in your, pressure maybe in your pelvic area, and abdominal swelling too. So next, on the next slide, I had pictures for you to view. So this is an ultrasound. It's characterized by a grape-like appearance, so it's kind of supposed to be kind of like a vine of grapes, a bunch of little cyst-like tumors that are growing. So this is going to be just a gestational trophoblastic disease inside the uterus, inside the sac with the actual baby itself. So that one probably was caught a little late on. Like I said, I feel like sometimes it's kind of hard to determine if you have something like this, if, these are normal symptoms of pregnancy. And this one is just going to be a sagittal view, an MRI of the uterus itself. No fetus is present, but that's going to be that disease in just the uterus. So on the next slide, I have more images for you. Sometimes it's referred to as a mole. So a mole is going to be another word for the group of cystic tumors. So this again is a sagittal image of little tumors inside the uterus. This over here is going to be an ultrasound with multiple cystic areas and no fetus in this image. And then this one is going to be an MRI of the same thing, so you can tell that the MRI is a better quality image, so it can be helpful in determining the extent of the disease. So MRI imaging. So typically this is just used to determine the severity of the disease once it is found with ultrasound. These typically are the sequences that are going to be ran. So lastly, I researched more on fetal imaging. So fetal imaging can be obtained using fast scan techniques. So these images can be acquired in less than a second, which allows for the imaging of the fetus quickly. So with MRI, there's going to be a lot of noise, and motion is contraindicated because it throws artifact across the image. So when you're imaging a fetus with a loud noise, it essentially scares it. So if you go to the next slide, by doing these quick 1 second images, you typically, and they're still a little blurry, but typically comes out pretty good. So the first thing I looked at was cleft palates. So in the first one, you're going to see that it has a normal palate. These are both sagittal views of the fetus in the womb. And then in the second one, the arrow is, you can see it's different, and if you see the front, that's kind of, I don't know if you can tell, but that's indicated of a cleft palate. So both these, so this one's an infant of 25 weeks, this one's going to be a 35 weeks, so these are different children, obviously, but this is going to be normal, and this is indicated with the cleft palate. So the next fetal imaging I looked at was going to be brains. So disorders with the brain. So this is an ultrasound. The arrows indicate enlarged ventricles, or what they probably thought were going to be enlarged ventricles. This shows, these are not the same infants, but this shows an infant with enlarged ventricles. So you can see the arrows, and this is the brain right here, and the ventricles should be much smaller. So these are going to be enlarged, probably with some type of encephaly. And then the last one is going to be a coronal T1 weighted image with a high signal intensity right here. So this is a coronal slice of their brain. This is going to be the skull. Right here shows a intraventricular hemorrhage, which is not a great outcome. So in summary, this article just kind of depicted how MRI is steadily growing in popularity. With it's used to typically used to determine the severity of fetal abnormalities and diseases. It uses no ionizing radiation, so it poses no known risk to the developing fetus. When performed safely, meaning that mom is not contraindicated to an MRI, no use of gadolinium, fast scans, things like that. It can be used as a very important resource to aid in ultrasound imaging. To the next slide, this is going to be my article I used as obstetric MRI. It was from the Journal of Magnetic Resonance Imaging. Any questions? Okay, thank you.